My name is Kelly Wells-Sittig. I'm the Executive Director here at the Iowa Cancer Consortium. I'm super happy to see so many of you on today and really looking forward to hearing what projects you're cooking up for the Iowa Cancer Plan implementation grant process. I also want to introduce my colleague, Liz Orton. Liz, do you want to give everybody a wave?
Hello.
Actually, why don't you introduce yourself, Liz, if you don't
Okay. Hello, my name is Liz Orton. My pronouns are she and her, and I'm an outreach coordinator with the Iowa Cancer Consortium. And I'm doing a lot of the administrative and coordination work on the grants. So you'll see my name a lot, but this is my first year doing that. So if you have deep, complicated questions, you'll also see me reaching out to Kelly for help with that too. So, but yeah, I'm really excited to hear what you all are working on.
Thanks, Liz. And when Liz says she's doing some of the coordination work, she's actually doing almost all of the work and the brain power behind this process. So she is good to know. And Liz, would you drop your email address in the chat for us? All right. And speaking of the chat, that's a great place. If you feel less comfortable coming off of mute to ask your question, you're welcome to drop questions in the chat. I know Liz will help me keep an eye on that, and we'll make sure to get those answered. Today can be really informal though. The purpose of our time together is to get your questions answered, to tell you a little bit about the, hopefully a lot actually, about the Iowa Cancer Plan implementation grant process. We want you to leave today feeling like you have some good direction for your application. All right. So again, for those who just joined us, I want to ask you to put your name and your organization in the chat box if you haven't already, so that we all know who is here with us. So I think if you're here, chances are you understand that cancer is a really complex disease. It requires a lot of different disciplines, a lot of different hands, a lot of different minds working together to prevent cancer and to reduce all of the negative effects of cancer, whether it's quality of life, quantity of life, economic effects. And that really is why our coalition exists, the Iowa Cancer Consortium, and every state has some sort of comprehensive cancer control coalition. They all look a little bit different. Ours is a nonprofit organization, the Iowa Cancer Consortium, and we are here to support folks like you who are working in or advocating for cancer control of some form, anything across the cancer control spectrum, so prevention all the way through treatment, early detection, quality of life, end of life, and beyond. So we are really fortunate here in Iowa. I mentioned that there are coalitions in most states, many tribes and territories. Here in Iowa, we are really lucky to have funding available for community endeavors and priorities that are outlined within our Iowa Cancer Plan. And we share that with communities in the form of these Iowa Cancer Plan implementation grants. So in a nutshell, this is what our process is all about that we're here to talk about today. Asking partners to, like you, to come together to identify an area in the cancer plan that you are interested in, passionate about, and that you want to work on. So thanks again for being here and for your interest and passion. So let's talk about the Iowa Cancer Plan. Hopefully you have all seen the Iowa Cancer Plan. Hopefully you're familiar with it. If not, I know Liz will hopefully drop a link in the chat for you so that you have access to the online version. The priority areas of the Iowa Cancer Plan, the current plan, which runs through just this year, fiscal year 22, are to address issues of health equity across the cancer continuum. Also then we have 4 very standard areas that you see on your screen. Oh, sorry, you'll see those actually in just a little bit. Let me show you the plan. So the 5 priority areas are, as I mentioned, health equity, and then prevention, screening, treatment, and quality of life. So those are the 5 key priority areas for the current Iowa Cancer Plan, which, like I said, runs through fiscal year this current, calendar year 2022. And there's the link, which I know Liz has dropped in the chat. So our fiscal year 23 Iowa Cancer Plan Implementation Grants invitation for proposals process has 3 priority areas, which I think you'll recognize within the cancer plan priority areas that I just shared with you. And really the purpose again of these grants are to support and implement the Iowa Cancer Plan. So our funding process right now, our priority areas are what you see here on the screen. So first, to address those issues of health equity, like we talked about, especially pertaining to systemic racism, rurality, socioeconomic status, gender identity, and sexual orientation. To address cancer control issues that have been especially impacted by the pandemic. So this could include things like cancer screenings, HPV vaccination uptake, tobacco use. And then also something that we try to focus on each year are opportunities to expand successful projects that have been done locally to expand them statewide in Iowa. So the timeline that we're looking at, this is all available on our website. April 1st is really the first big deadline that you all need to know about. Letters of intent are due. Those can be really simple. It can be an email of a couple sentences to Liz that just says, hey, I'm so-and-so from this organization or representing this group. We plan to apply for an implementation grant. We're interested in prevention, specifically this area, and here's a quick sentence about what we think our grant will address. That was more than 2 sentences, but it can be very brief. It can be an email. It doesn't have to be anything super formal, and it doesn't bind you to anything. What it does is really lets us know what to expect for full applications, but they are required. So be sure to get your letter of intent in by April 1st. And then on May 6th, our full applications are due. So again, May 6th, but this is all in your information packet that hopefully you've received via email or downloaded from our website. So May 6th is the final deadline. We hope to let everyone know about awarding plans around June 24th. Now this, in the spirit of complete openness, this is always a little bit flexible because the consortium itself is grant funded. And so our own funding, which dictates what we can fund in implementation grants, we always find that out towards the end of our fiscal year. So towards June, the end of June as well. This is a special year because there's a 5-year cycle. So we are a little less clear about what our own funding will be next year, which again dictates how much we have to disperse in grant funding. So I tell you this just as a way to ask for a little flexibility and to manage expectations that it will be around June 24th, hopefully, that we can let you know what you've been awarded, if you've been awarded, but that may flex a little bit. And then the project periods for these grants run from July 1st through May 31st. So it's an 11-month project period. And if Liz hasn't already, because I don't have my chat pulled up, but if Liz hasn't already, she'll drop the link to the grants in the chat box. Oh, I shared the timeline with you and didn't show you the timeline slide. But I will back up because this is my dog, Annie, very carefully reading the Iowa Cancer Plan. And so if you have a furry friend at home, they can be great grant planning partners. A couple notes about the budget for your grants. You can apply for up to $25,000 per project period, so per year, even though again, the grant period is 11 months, not 12. You can apply either for a single grant period, so 1 year, or you can apply for a multi-year, so up to 3 years. Important note, if you do apply for a multi-year grant, you still have to reapply annually. And $25,000 would be the max each year. So for a total maximum of $75,000 over 3 years. Again, the amount that we're able to award year to year depends on our own budget. And so if you apply this year for a multiple year grant and are awarded that, that doesn't mean that your second and third year grants are guaranteed. It just is really all dependent on our own budget, which has been very stable, but we still like to be very open and honest about that. Your project activities have to serve Iowans. That's an important requirement. And they really need to mostly occur within Iowa. There have been times we've had folks say in the Quad Cities or in Omaha, and we can make exceptions for those. We would just ask to have a conversation about those. But generally, projects have to occur within Iowa, and they definitely have to serve Iowans. That's really the intent of these dollars. All activities that receive funding through an Iowa Cancer Plan implementation grant have to be entirely tobacco-free. So for example, project events, if you get funded and part of what you're working on is to hold an event, it needs to occur at a location that does not allow smoking or other tobacco use. Here are also some other things that we do not generally fund. So grant funds through this mechanism may not be used to replace dollars that are currently earmarked for programs and projects. And to add a little bit onto that, I know our board has had discussions, so our board makes final funding decisions, and they've had discussions in past years. They don't want to see applications that are specifically to fund one program and one cancer center, for example. They're very interested in collaboration, in amplifying and expanding work that's happening across the state. So just keep that in mind with your application. Collaboration is key, and these funds are not meant to replace budget dollars that you already have within your programs and projects. Funds cannot be used for any lobbying purposes. And if you have questions about what the difference is between lobbying and advocacy, because advocating is great. Advocating is education. You can advocate to policymakers. You cannot lobby with these dollars. And we would be happy to talk to you about what the difference is if you have questions for that. Generally, funds can't be used for clinical care, including provision of medication, vaccination, and treatment. We have had some exceptions to this where our board has felt that, for example, a project is focused enough on addressing a cancer disparity that they felt like it was a great use of funds with this intent to fund some direct clinical services. But in general, that is not the intent of this particular funding mechanism. Community organizations and collaborators are encouraged to provide financial support for pieces that this funding mechanism can't provide. So for example, if you have a project that may go along with some clinical care, if you have, that would be great if you have partners who are able to fund that clinical care piece, for example. So the project can certainly relate to that, but the board would like to see that those dollars are not necessarily being used for clinical care. Incentives are an allowable expense as long as they are proven to be an effective part of an evidence-based intervention. So we can talk about some resources for evidence-based interventions here in a little bit. In your application, if you are asking for incentives as part of your project, and especially if the incentives are built into your budget, be sure to explain those very well, including the purpose, why they're needed, where you find the evidence for those, and what the need is. And this is really an area, this is a good time actually to pause and mention that I've told you that our board makes final decisions, final funding decisions. Before that, our grants are externally reviewed by some independent reviewers. And even before that, our staff is available to help you craft your application, your ideas. Our staff does not participate in funding decisions. We don't formally review for decisions, the applications. We can help you. And this would be one, like incentives would be one place where you might want to check in with a consortium staff member or a volunteer evaluator who we can connect you with, just to talk about how to best outline that within your application. You can contact us. Our information is on our website. I know Liz has put her email address in the chat. There are lots of ways to get a hold of us, and we have a really good team who would be happy to help you with that. And I will also recommend referring to our newest blog on our website. And Liz, would you be able to drop that link as well? Thank you, which will provide some good information for you as well. All right, so I mentioned some good resources. So we've got a sample budget worksheet for you in your packet, and a sample letter of intent and a sample letter of support. You do need to have letters of support from your collaborators. We can answer some questions about those if you have them here in just a little bit. Liz has dropped the link to the blog post about evidence-based resources and program planning. That will be a really good resource, really good place for you to start. You can take a look at our fiscal year 22 funded projects. Liz, will you drop that link too? Awesome, if you haven't already. And then you can see a picture here of the Cancer in Iowa 2022 report. If you're not familiar with the Cancer in Iowa reports, so excited to introduce you to those reports today. The Iowa Cancer Registry, who's an important partner of the consortiums, puts a report out every year that estimates cancer mortality and incidence rates for our state, specific to our state. They show those broken down by county, and they show them broken down by rural areas, urban areas. There's a lot of really great information. They also have a special topic every year that they dive a little deeper into. This year's topic is screening, the importance of screening. There's also some genetic counseling information in there as well. So consider that a really good data resource. And I'll also mention that the Iowa Cancer Plan also has some good data targets and sources. So if you, as you're looking through the plan to see where your project aligns, be sure to check out the data targets throughout the plan, definitely associated with the goal that you're looking at. And if you need additional data sources or have questions around that, let us know. And as I mentioned, our staff is here to support you. This is a big part of what we do. And if we can't answer your questions, we have a bunch of partners who are really expert grant writers, wonderful evaluators who are happy to help with that. So if I could provide one piece of advice to everyone as you're crafting your project, please, it would be to please reach out to a staff member and just say, hey, here's my idea. What do you think? Do you have any advice? We would love to talk to you about that and try to help you craft it in a way that is hopefully going to be exciting to the board and to our reviewers. Making contact with a staff member isn't required, just so you know, and it won't affect your score in any way. It's just a free opportunity that's available to you. As I mentioned, reviewers who are external to the consortium review grant applications before the board gets the final scores and makes the final decision in June. And now you get to ask questions. Hopefully you got some information, but really this will be the most important part, I think, of our time here today is the opportunity to ask questions. I'm going to stop sharing so we can all see each other. Okay, I see a couple of questions in the chat here. So Kelly Gertis, thanks for your question. Does the consortium offer access to reports of current and past funded programs? That's a great question. And honestly, the answer would be yes. So grantees, as a grantee, you would submit reports quarterly to us. We try to keep them simple so that it's not a huge burden to you. And we could look at sharing some of those if folks wanted to. I believe Liz shared the list of current grantees. Is that right, Liz? Did you share that? Okay, so that would give you an overview of who is currently and successfully funded. If you need more details about any of them, reach out to us and let us know, and we'd be happy to talk to you about that. It's a great question, Kelly. Okay, thanks, Liz, and Liz just shared that link again. Mary asks, if you received a grant in 2022 and it has been successful, can you apply for year 2 funding, even though you didn't originally request a multi-year grant? Yeah, great question. Yes, you absolutely can. I would just explain what you just explained there. So great news. We had a 1-year grant. It was really successful. Here's how we think we can grow it again in year 2. And if you want to end up asking for year 3, you can absolutely do that. I would use the multi-year application, and Liz or I or anyone could help you work through this. Just clearly explain your success in year 1, why you're asking for year 2 and or year 3, and use that multi-year application to request your additional funds. But yep, you sure can do that. And we've had people do that successfully. Great question. What else? Liz just messaged me a wonderful question. Yes, so new this year, you can budget and request administrative fees. So in the past, we have not allowed that in our application. You can do that this year up to 8%, which I just want to recognize is low, is a low administrative rate, but it's really what we're able to offer right now. We recognize that especially during these times, those administrative rates can be really important for organizational sustainability. And so that is an allowable expense this year. If you have, if you need additional expenses that might otherwise be rolled into administrative rates higher than 8%, we just ask that you actually write those out in your budget. So if you're feeling like there's no way I can apply if the administrative rate is only 8%, but I've got this great project, put the remaining expenses in your budget and just justify those. And our board will consider them. I can tell you, we probably won't be able to fund very high administrative costs. 8% is really going to be where we're going to have to land or below for most. But you can request those this year. All right, Jordan asks, if a collaborator partner that we'd like to work with on the grant is also applying for funding, could that impact our application? Only if they're applying for the same project. So we will only fund one group for one project. But if you have a partner who is applying for something completely different, a different project with a different scope, but you're both supporting each other as collaborators, that's okay. You can do that.
I was going to add, Kelly, about the question, like if a partner organization is also applying, one of the benefits of kind of looping us into your ideas is that if we know that there's a really similar idea, or we know that there's a group that could use the part that you have and you could use the part that they have, we can facilitate those connections. we'll make sure that, you know, you are okay with whatever we're doing, but like, just have cluing us in so that we can really fill in all the puzzle pieces is important too.
That's a really great point, Liz. And I'll even add on to that, that if you're struggling to find collaborators, I mean, ideally, this is an early conversation because this is really at the heart of what the consortium does. So it doesn't even have to be with a grant. If you're looking for a collaborator on something, talk to us and we can definitely help with that. Again, have that conversation early, have that conversation anytime, actually. Like if you're thinking, I need someone who's in this county who is a healthcare administrator, give us a call. We can see what we can try and connect you with. And collaboration is key in these. So again, our board and our reviewers are going to want to see really good collaboration within the projects. Liz, is there anything else that you would add that I might not have touched on?
I don't think so. We do have another question in the chat that just came through.
Where does cancer navigation fall? Good question, Kelly. I'm going to tell you how I interpret that question, and you tell me if that's right. So I interpret that question as, is that direct services? Is that kind of what, and if you want to come off mute and tell me if that's not right.
Well, maybe.
Maybe.
Sorry, maybe.
No, it's a great, I mean, it's a great question.
It's not it's not a service in that the patients, they opt in. They don't, it's not a part of their treatment. It's cancer, it's a nurse navigator who comes alongside the patient and helps coordinate everything that they need. So dietary treatments, radiation, chemotherapy, psychological counseling, survivorship support groups. She's the resource person.
Yeah, okay.
And we're expanding that out to more rural satellite clinics, which is really needed because they can't all come in here, which is what has to happen right now for them to have any kind of navigation.
Yeah.
So I don't know. I don't know if that's direct service. Does it fall in that?
Yeah, so I think that's a really great question. So a few thoughts that come to mind with that. I think patient navigation is going to be of interest. Like I think that's a service that isn't offered a lot of places, but we all know how effective it can be.
Yes.
So I think there will be interest because of that. If I were writing your grant, so keep in mind, I can't predict how reviewers are going to score or how our board might fund on a particular day. But if I were writing your grant, what I would focus on in that case is, so you're going to have an easy time finding the evidence base for patient navigators. I would focus on how can I document what we're doing in our area. So how do you implement this project? And then how do you share it out using the consortium's network? So how can other consortium members and partners benefit from learning what you've done? So I would definitely focus on that. And then if there's any sort of collaboration that you can show, so satellite clinics, I'm assuming then within the same system, but are there other groups that you can, like community organizations that you might be able to partner with to kind of amplify that navigation service in the communities where the satellite clinics are? So I think pulling in collaboration and then talking about how you can share what you've learned through the consortium network, and we can help you talk about some ways to do that as well.
Mm-hmm.
So if we were to think really, really big picture, I think what the board would love to see is how is the work that you're doing helping your community and the people you serve? And then how can we use this beautiful network that exists of 500 plus people in the consortium to learn from each other, to share what we know, to work together to ultimately have a bigger impact in the state. So we're not, which is a big idea, right? Like, and I don't want to scare you away from this opportunity, because you don't have to show exactly that in your grant application. But I think if we can think of like through that collaborative piece and kind of that bigger picture, and just make sure to fold that in a little bit, or at least like how are we thinking about that? I think that will benefit you in your application. And one more thing specifically with that, but really that would apply to all projects, is sustainability. So for example, if you're starting a new patient navigation program, got great collaboration in communities, it's going to be a model that you can share with others. If the consortium provides funding to get that off the ground, how will it be sustained after 1, 2, or 3 years so that the impact is lasting?
So if it's already successful here, because it is, but the intention in my thinking about the grant was we want to expand it out to more rural,
Yep.
to give more rural access to our navigators. And there's a lot of things involved in that. There's interpretation, there's interpreters, there's all kinds of good stuff that will speak to some equity issues as well. So then we already know it's successful here. So I would be writing about how it will be successful as we reach out, and then more collaborators is what you're saying through your consortium.
Yeah.
Or not? Am I not?
No, I think that's right. So
Okay.
it sounds like you're on the right track with, so I mentioned earlier, the intent of these dollars is not to replace things that are already in your budget. So
No, this is new
right, you're
outward.
expanding, right, exactly. And I love the rural focus is awesome. The expansion is awesome. So I think what the board would want to see is, these costs are associated with providing that navigation to those clinics. How will that be sustained financially once the grant is over?
Okay.
Yeah.
Thank you.
Great. Yeah, great questions. Okay. Don't forget, your letters of intent are due April 1st. And Liz, maybe you and I can just hang on in case anybody wants to talk about their grant idea. But otherwise, thanks for spending a little time with us today. Thanks for your interest in the grant. We hope to hear from you all, and hope you have a wonderful afternoon. Thanks for all you do, everybody. Feel free to hang on and chat if you want.